All right, good morning, everyone. It is Monday, June 7th, and we've got 9:02 a.m. And thank you, Phil, for that wonderful introduction song. We'll have to do that every week now. So we're back at it. Last week we were out, but here we are again. And just as a reminder, what's our mission here at Health Plan Markets? We are out there to improve the lives of our community by helping them find affordable health care. And not just health insurance, guys. Remember, working with physicians, doctors groups, and other community organizations that can help connect people to improve their health care. So, you know, today and tomorrow I'll be meeting with some physicians, and thanks to Nick and his hard work putting together those relationships, just keep in mind that we are in need of agents to work these doctors' offices. And if you are interested in taking on those opportunities, please make sure you reach out to Nick or someone at Health Plan Markets so we can connect you and make sure that you're able to get in front of these doctors. Before COVID, doctors were our #2 lead source and growing, and so I see that becoming a trend here moving into 2021 and 2022. So just a shout out, if you are interested in working doctors' offices or if you need more action from doctors' offices, please connect with Nick and we'll get you plugged in. Okay. Now, we'll need to go through training on that because you can't just walk into a doctor's office and expect them to cough up a bunch of leads. We know how that works. So you're going to have to go through a training class with Nick just to make sure that you're on the up and up on how to work these doctors' groups. Okay. But speaking of training, like we do every call, let's talk about what's out there for training this week. So today, Devoted is still doing their broker coffee and chat sessions. That is at 11 a.m. It's geared for the Orlando market. However, if you have any questions about Devoted, Jeanette will be there to answer those questions at 11 this morning. Remember, the link can be found on our training calendar. Everyone should have a link to that training calendar and hooked up on your phone, laptop, or iPad so you know what's going on. All right, tomorrow, Tuesday, June 8th, 10 a.m., Humana is doing their enrollment hub training. So, yes, we are rolling out our brand new quote and enroll tool, and we just started rolling that out, so you'll be reached out to as far as getting that set up so you can start using it for your clients. And then we're going to have a nice event where we're going to do a training session on our new quote and enroll tool. But in the meantime, if you're interested in learning how Humana's enrollment hub works, you can go and check that out at 10 o'clock tomorrow morning. Also, tomorrow at 11 o'clock, Cigna's doing a training on how to sell more with social media. And I can tell you social media is always evolving and changing. And we've seen some great trainings from Humana and United, and now Cigna is rolling these out as well. I think Aetna had some social media training. Always good to check out what's going on social media if that's part of your strategy. Okay, there's a ton of ways to make money in this business and to help people and connect with people. Social media is one of those ways, so if you are interested in learning on how to get social media going, that's tomorrow at 11. I will tell you that that is a long game strategy. You can't expect to just go and pop up, you know, a post and get sales right away. That is a long-term strategy. So just keep that in mind as you're learning how to do social media. So training's on Wednesday, and then we're jumping over to Thursday, June 10th at 10 o'clock. Simply is doing their face-to-face training. If you are a new agent or you're interested in adding Simply Healthcare to your portfolio, they will be doing a face-to-face training. This is mandatory if you're first coming on board with Simply. If you're already contracted with Simply, no face-to-face required, of course, especially on the Recerts, which we're going to talk about in a minute. But your Simply face-to-face training is going to be at 10 o'clock on the 10th. And again, that's if you're adding Simply for the first time. Simply does things a little bit differently. You've got to go to the face-to-face training before you get trained and certified. So you do the face-to-face first and then trained and certified. And that is, I believe, 100% virtual. So you don't have to go anywhere, but you do have to be on that training session. All right. Also on the 10th, Devoted is doing another coffee and chat session, this time at 11:30. The devoted coffee and chat session is geared for the Jacksonville market, but again, if you have any questions about devoted and you want to jump on that training, they'll be there. Devoted's got some hot products. I'm hearing rumors that they're going to have really great things coming out for 2022. We're going to talk a little bit about that later, so it's a good idea to get connected with those growing companies. And then last training for the week on Thursday, the 10th at noon, Humana is doing their VA healthcare and Medicare training. So Humana has been a huge advocate for veteran affairs. In fact, they've got a lot of different marketing materials that are out on the portal that you can access, and they've got trainings all the time on how to work with veterans, how to go and get in front of veterans, and how to service veterans with the right health plans. And although this training is for Humana, if you want to learn more about veterans, this is a fantastic training platform for you to get in with veterans and to understand how they operate, how they think, and obviously to help them pick a plan and which one's going to be best for them. So great strategies, great marketing on how to get in front of veterans. So that's the training for the week. Remember, guys, all these training sessions have the link right into the event itself. So once you click on it, you've got the link to register right in there. So thanks to Tom, he puts that all together for us every week. So we do appreciate that. Now, it is June. Believe it or not, it's already June. And what does that mean for us? Well, 2022 certifications are now starting to be rolled out. AHIP will be rolling out, I believe it's the 25th of this month. So we're going to be gearing up to take on the next plan year. So it's happening again. So the trainings, the physical trainings will probably start slowing down a little bit. However, I will tell you this, AHIP is the first thing that we've got to tackle for Medicare. Get that done first. Do not delay. Please do not wait until the last minute to do these training sessions, because if you're offering 5, 6, 7 different carriers, remember you've got to do each and every recertification every year, and they average about an hour and a half apiece. Okay, so that's what you've got to do. Your AHIP is going to average about 3 hours. Some people do it faster, some people break it up. It all depends, but on average, you're going to spend about 2 to 3 hours, including the test, doing AHIP. Okay, so there's trainings coming, and your recertifications are most important. Please also keep in mind, if you have any active clients, if you're getting paid commissions and your renewals, you must recertify every year in order to maintain those renewals. You decide, okay, well, I'm not going to recertify for Aetna this year, for example. If you do that and you have 10 Aetna clients, you will not receive any more commissions for those 10 Aetna clients if you do not recertify by December 1st of the year. So we have a long time to recertify. However, you cannot sell the 2022 plans on October 1 until you're completely certified and ready to sell. So don't delay, especially if you have a lot of clients already, or you have a lot of plans that you currently represent. You just want to knock out, at this pace, really just one a week should keep you on pace to be ready by October. But I know some of you are hungry to get those over with. It's another year, and as soon as they get out there, some of you are fantastic at getting through those trainings very quickly. So we've already heard that Humana, United, and I believe Aetna is already rolling out trainings for later this month. So AHIP first, and then you can go ahead and jump into the plan-specific trainings as well. We anticipate ACA training to come out sometime in August or September of this year for November 1st. But just gear yourself up for certifications. We will be hosting some testing days at health plan markets. Another just quick tip here, we do recommend that for AHIP that you go through all of the modules, pay attention to the quizzes. The quizzes are virtually the same answers that are on the test, so make sure you understand and pass each one of the quizzes on each one of the modules, and do whatever you can to remember those questions, because most of them will be on the test. But we do recommend that you go ahead and take the first test by yourself. If you pass, fantastic, congratulations. move on to the next certification. If you do not pass on your first attempt, do not continue. Please reach out to Health Plan Markets so you guys can come in and we'll guide you on what you missed on the first test, and we'll have you take the test in our office, and so we can make sure that you're understanding the materials and we help you pass that test. Okay, we're not going to do the test for you. That is not legal. We're not allowed to do that for you. Don't ask us, okay? But you're going to take the test, and we're going to be there side by side to make sure that you're understanding the material, because that's most important. You're understanding the question and you're answering it better now that you understand that question. Okay. Okay. So that's 2022. There you go. So that's coming out. All right. Now we have a few SEPs that have been rolling out here. If you've been checking your emails, you've been seeing what's been happening with SEPs. So the first one is a limited SEP. This one's for what I saw in the Florida market, Hillsborough, Manatee, and Pinellas counties. They do have an SEP, but it is only being accepted for devoted right now, and they declared a state of emergency on 3/25. So any applications in that market, you can write devoted, and you're just going to mark on there FEMA emergency, and you can do that all the way until August 31st or September 1 effective. So you have that SEP available today to use in that market. Outside of that, the other SEPs that we have for Medicare is WellCare. So WellCare is accepting the fuel shortage. I don't know if you guys remember last month, hackers got into a pipeline system which shut down fuel production for a while. And so WellCare got the clearance from CMS to have an SEP available for the fuel shortage, and that SEP is available nationwide, but just for WellCare. Let me repeat that. WellCare is the only one accepting this fuel shortage at this moment right now that I've seen, and they're accepting it up until August 31st for September 1 effective. So again, for these SEPs, if you come across somebody today or one of your clients calls you and says, hey, look, I need to join a plan, or I need to get out of my plan or change my plan, you have this SEP available. You're going to use that SEP. You can only use it one time per client, and it will be for the first of the following month. So if you meet them today, you use the fuel shortage SEP, you'll select 7/1 effective. So July 1st effective is what you'll need in order to process that application. You can't future date it on these SEPs. They have to be first of the next month. So that's available. And again, if you're in Georgia, New Jersey, California, wherever you're doing business, if WellCare is there, they're accepting this SEP for August 31st, or up to August 31st, starting today immediately. Okay, so you got to get out of jail for free card with WellCare. So go out there, meet people, talk to them, and if they're unhappy with their health plan, this is a way to get them out of that plan. Okay, and you can get them in for WellCare. So there you go. Okay, a couple of updates for the plans. First one is for Humana. As you know, you all receive an additional compensation for doing HRA forms for each of the health plans. Some of the health plans compensate you for that, Humana being one of them. And remember that HRA stands for Health Risk Assessment. This is basically a scorecard for your client's health, right? It's a snapshot for the doctor on what's going on with their health, basically a giant physical that you're going to help your client complete. Now with Humana specifically, you now have 5 days after the application. You have 5 days after the application to process a health risk assessment form. If you do not process that health risk assessment form, you will not be able to do it on your side, and you will not earn that additional compensation for doing that HRA form, which I believe is $50 for Humana. They do vary depending on the plan, okay? But best practice, and I'm going to do this pro tip, best practice is get it done at the point of sale. So if you're already there with your client, you've just completed the application, go ahead and get that HRA form done while you're there, while you're on the phone with them. Don't wait, just get it done, okay? So with Humana, you're going to have 5 additional days to get the HRA done. So if you have an issue or you're not able to get it done or complete it because of limited time or whatever the case might be with your clients, go ahead and do that HRA form. You know, you can do it up to 5 days after that. So keep that in mind if you are going after those HRA forms. I personally like the HRA forms. It's going to help build those relationships with your providers, your doctors groups, because the doctors want that information when the client's coming in. So if you help enroll a brand new client and you put them on a plan and they have the HRA form from the health plan when they first get started on July 1st, it makes that transition, it makes that relationship with the doctor and the client, your client, a lot stronger. They come out of the gate and they're already running full speed. And that's really what you want, because for you, you want to be able to know, this is your first objective on why you want to work with doctors. You want to know that any client that you put with that specific doctor, that your client's going to be happy and you're not going to get a disenrollment, right? You're putting them with a group that you feel confident is going to keep your client happy, keep them safe, and do the best that they can for them. If you don't have those relationships out there with doctors, it's going to be hard for you to sleep at night knowing whether or not your clients are going to be taken care of properly. And if they're not being taken care of properly, the back door is still open for them to leave. Remember, these SPPs now, you virtually have 5-star. I mean, there's no reason why you couldn't get somebody in disenrolled or enrolled. But your competition knows that too, so you've got to serve your clients, and one of the best ways to do that is making sure that you've got a great doctor that you're working with, okay? So HRAs are a plus. The doctors really like those forms. Get used to them, and you get compensated to do them. So I am a fan of those. Okay, so we're going to switch gears here and talk about marketing here just for a minute. And then I'm going to talk about a concept. Just want to make sure everybody's on the same page with as far as benefits that are going to be coming up for 2022. So the first thing is marketing supplies. And I've got my screen up here, and a lot of these carriers now have marketing supplies that you can access virtually. With most of the major carriers have access to this. So you can go into your portal systems and go into your marketing supplies, and you're able to create customized pieces in order to do your marketing. So I'm in United Healthcare. I'm going to pop this over so you guys can see it. This is the promo area that you have. So when you're in the Jarvis United Healthcare link, you'll drop down to Sales and Marketing, and then you're going to click the United Healthcare Toolkit. And in this toolkit, and this is just United's, of course, there's a lot. You've got Humana, you've got Aetna, you've got Cigna, Care Plus. All of these companies have now portal systems that you can use to create customized pieces. So you're getting emails on this, folks. And I know all of you are reading your emails, and I know, but sometimes you forget, or sometimes you don't know what's out there. So I'm highlighting a couple things that I really like. So United Healthcare, their toolkit, you have information and marketing supplies for chronic special needs. You have it broken up by segments, dual special needs, Medicare Advantage. You're doing supplements and prescription drug coverage. You have marketing supplies there. But let's go into the Medicare Advantage. Once you click that, you'll click Explore. You go down in there, and you're going to hit the home page there, and it's got different things, anything from flyers to posters, even a billboard that's already pre-created that you can just pop your stuff in there. I like the postcards, and you've got a relationship letter here. You've got business-to-business small letters. I mean, you've got things just as simple as a bingo card. And these are customizable and instantaneously downloadable. So you can go ahead and download these pieces once you create them. You can order them as well and have them shipped to your home. If you want to go all out, you can do that. But let's take a look at one of these postcards here, and you can see how simple I'm going into this. So this is the proof here. you can actually see what it looks like, and I've zoomed in here. This is just a postcard. I think it's 6 by 11 is usually what they're doing these days. It's got the Medicare card up front, and then, of course, your information down at the bottom, and then they've got a way that you can flip it over here somewhere. Okay, here we go. And you can see what's going on the backside. Here it is. So obviously the address goes there and postage. If you are interested in doing this type of marketing, need a little bit of help, just reach out to us, and we're glad to guide you on this. I'm going to be training my team on how to get into this and help you. But remember, guys, you're self-sufficient. This is your business. This is how you run your business, and how are you growing it. So marketing obviously should be at the forefront of your mind every day. What am I doing for marketing? How many appointments do I have today? And what am I doing for lead generation? So these are things that you need to always be thinking about every day. This is part of your job, okay? So in here you've got, postcards. Now it says 15 cents. If you get those printed, you can do that. But as you can see, once you create the piece, it's a free download. But let's go back here, and you can take a look at some of the other pieces here. Flyers, and you can break it down into different categories as well. This is a flyer for a PPO, so if you go in there, if you want to promote the PPO, or if you have a doctor that really likes the PPO product, you've got a flyer here, and these are all professionally designed. All you got to do is plug in your information. You can literally get this thing done in just a few minutes, okay? And I've done this before, and right here, here's the button for customization, and it's just follow the bouncing ball, and you can create your piece. And once you create your piece, it has a little preview here, so you can see exactly, what you're doing there, okay? So please take advantage of that. Dive around, explore. Even if you can't figure it out or you get jammed up for whatever reason, at least you'll know what's out there and what's available. Now, one thing I'll tell you about United Healthcare is most of the DSNP stuff is free. Okay, so if you need, let's go over to the DSNP products, and you'll see things like, of course, the flyers. They've got the magnets here, but things like the pull-up banners. See, you've got pull-up banners here. I've seen flags, brochures, clarity guides. I mean, all sorts of stuff that you can get for free for the DSNP. This is a feather banner. Those are those things that you stick in the ground. So if you're out there doing events, these are great things to have, and they're yours. They're yours to keep. It has your number, your information on it. It's yours, okay? So dive around in there, and I hope you guys take advantage of that, because it's some really, really great resources that are available for you. And, now United, just like Humana's doing, is they're going into the veteran market as well. So they have a new product called the Patriot Plan, and in there they've been emailing you guys about all the new things that are available with the Patriot Plan. So flyers, meetings and benefits, letters, banners, tents even. I mean, they even got tents in there that you can order if you're so brave. So all of that is available for you at United Healthcare. So take advantage of that. I really hope that you do that. Okay, and for the last 4 minutes, I am going to talk about, I had this question posed to me by an agent last week, and they said, hey, you know what, Justin, it might be a really good refresher for us, and even for those rookies or intermediaries that haven't really, thought about this, or maybe have thought about this but haven't gotten a clean answer on it, is why are benefits different in certain counties, okay? So in my sales career, I did a lot of work in Orlando, but from time to time I would jump the fence into Polk County or Lake County or Volusia County or sometimes Brevard County, and as soon as I crossed those county lines, the benefits would change from Orange, Osceola, and Seminole County, okay? So why does that happen? Why does, Humana's plan in Orlando differ than the Humana plan in Volusia County or in Lake County, just outside of the Orlando market? And you're seeing this across the country. It's not just Orlando. It's everywhere. And you'll usually see those jumps in bigger cities, right? So bigger cities have better benefits. Why is that specifically? Is it just because of more people? Well, that's part of the equation, okay? So CMS has deemed certain areas in certain counties in different categories. And the way that CMS has determined these categories is one by population and population by Medicare. Okay, they don't care about total population, but how many Medicare eligibles reside in that county. Okay, so that's the first metric that they're looking at. Okay, and then how healthy is that membership? Do these folks use the hospital quite often, or do they have a more controlled approach? Are they better served with primary care doctors in these areas? And that's determined by their score, their HEDIS score, which basically is a determinant on how healthy a person is, and all of their tests, are they being done? Is this population relatively compliant based on Medicare standards? So that's the other part of it as well. And then you look at the healthcare networks that are available in these counties. Obviously, Orlando being a major metropolitan area, although they have a great network, even if you compare it to, you go down south to Miami, which by the way is the #1 area for Medicare in the country, and I'll talk about that in a moment, it's still, Miami has more doctors, they have more hospitals, they have more services available to their population. So yes, the Medicare population is larger there, but you also have more network available as well. So those are some of the metrics, and what CMS does is they put that all in a blender, and then they come out with a per member per month score on what each of those members is worth. Now individually, it's an average, okay? So just as an example, let's say that in Miami they get, and I'm just saying this as an example, let's say they get $10 per member, just as an example here. Well, because Orlando is less populated, the scores aren't as high, and the network's not as strong, the cost of the member might be only 8 or 7 versus Miami at 10, okay? So that money represents what CMS is going to pay the health plan. So although there's a Humana plan in Miami where they earn, quote unquote, $10 a member, Humana's plan in Orlando, they're only making $7 a member. So case in point, you're going to have stronger, richer benefits in Miami than you are in Orlando, because they're not making the same amount of money on a single member in Orlando as they are in Miami. Okay, so Miami is the #1 and the highest paid CMS allowable rates. So that's why you see most health plans try to get into the Miami market, because the money is the highest in the country as it's represented by CMS and what CMS pays the health plan. So those benefits reflect on how much they're actually receiving for CMS per member, okay? And sometimes we'll see areas that go from a low rate and then they start shifting gears and maybe they get a higher rate. One perfect example of that is Polk County, which is just south of Orlando, between Tampa market, and so they've kind of been linked in and looped in to the Tampa market because their population has grown and you have more seniors moving out there, and now the networks are following them and the health plans realize this, and so CMS is upgraded them, and now they make more money per member per month than they did before. So now you have plans that have richer benefits, and that's where you see in 2022 maybe the benefits start to get less expensive for your members, and that's because CMS may have upgraded the score in that area, earning them a little bit more money. So that's a big general overview on why benefits differ per county, and remember, it's by county. And that is the major reason why, is because of all of those metrics that I just explained. So at the end of the day, it boils down to money, yes, but also how well the members are taken care of and how well the members are responding in those areas based on their health care and what's available to them. So happy to answer any more detailed questions. This also correlates greatly with the physicians because the doctors are looking at new places to open offices, and so they usually follow those trends and take a look at areas that are growing, knowing that if they invest and go into new markets, eventually CMS may follow up and increase those dollar amounts per member. And that's why you see also expansion from health plans going into new markets and new counties that they weren't there before. So it has to do with profitability as well. All right, so with that, our call is completed here. I'm going to go ahead and open it up. If anyone has any questions, this is a great time to ask questions, and I'll be glad to do my best to answer them. Here we go. All right, any questions?
Good morning, Justin.
Good morning, sir.
Hey, how you doing?
Good, how are you?
Okay. Question that comes to mind is regarding the HRA form with Humana. The HRA form, for example, Aetna, I do them all the time. It automatically comes up, you know, when you're doing an application. Where do you find the Humana HRA form? Is it a separate thing that you got to, hunt for?
You can. It's in the Vantage portal, and I don't have time today to show you how to get into it, but I'll make a note to do it next time so I can show you guys. But you can reach out to either Jesse or a manager at Humana, and they'll get you over a copy of it. But they are working in the same way that the health funds are now figuring out to give you that option to do it at the end of the application. I do know that they are integrate that. And also, case in point, our new enrollment software, by the end of the year, will have the capability of doing the HRA form connected as well. So it's coming. But if you can't find the HRA form, you could reach out to Humana, and they'll get you over a copy of it, or they'll show you in the Vantage portal on how to get to it.
Yeah, because it's a little bit cumbersome. If it comes in automatically like the way Aetna does, you know, you're going to do it because it's sitting right in your face.
Yeah, exactly.
So, anyway, so that's why I guess I've not done them, but because you got to, I guess, go somewhere else. But anyway, that was my question.
Yeah, no, that's a great question, and you've also identified a trend on what's going to be happening here in the next 12 months. Is probably most all of the carriers are going to integrate that HRA form into the applications. And I'm surprised, and well, actually, CarePlus started doing it, and I think a couple other plans where they actually have the paper versions in the kits as well, in case you have an issue with technical, with internet and things like that. But yes, I absolutely think that most of the carriers are going to follow that trend that Aetna has, where at the end of the application, you're going to have the option to go ahead and complete the HRA form right there and then. So that's going to be great. I don't know how long they're going to do this additional compensation model. So just know that is right now, take advantage of it, but that could go away. We see that as a possibility, but take advantage of it while you can, and obviously help those folks that need the help.
No, I know the Aetna one, that $90 comes in real handy.
Yeah, absolutely. And by the way, that's compensation that is not subject to chargeback. So even if you decide to roll, because you have done an HRA form, which is not technically part of your job, it's what they call an administrative. You get that money regardless. So it's a nice little guarantee to ensure that you didn't waste your time.
Yeah, that's it. That's for sure.
Yep. No, great question, Will. Thanks again.
Yeah, thank you.
You got it. Any other questions I can help with? right. Well, go ahead.
Okay.
Okay, if there's no other questions, then we'll go ahead and end here, guys. I appreciate your time and attention, and I'll have this recording out to you later this week. I'll shoot it out to you so that way you can review it. Those of you that are on the call and would like to see the visual aspect of this call, I'm also recording it for YouTube, so that's where I'm sending that out. I'm hoping everybody has our YouTube channel and has that. Just make sure you save that in case you can't jump on the call one week. You're able to review that. But we'll always send it out to you by text and email so you can get what's going on and what's new in the industry as we move forward. But until next Monday, I hope everyone has a fantastic week. Go out there and market yourself, become famous, and help as many people as you can. Hope everyone has a fantastic day.